All right. Welcome back, everybody, to a brand new deep dive. And today we're going to be talking about something that I think a lot of people have heard of, but maybe don't really quite understand: the placebo effect.
Yeah, the placebo
We
effect.
got some pretty cool research on it,
Yeah.
and I don't know about you, but it's really kind of blown my mind a little bit, like how powerful our minds can actually be.
Yeah.
You know?
It really is. It really is. The more we learn about the placebo effect, the more we realize just how connected everything is,
Yeah.
Like our mind and our body, how they're kind of intertwined.
Yeah.
It's pretty fascinating.
Yeah. So I guess like to start off, what exactly is the placebo effect? I mean, a lot of people have heard of it, right? But like, what is it really?
Okay, so the placebo effect, it's basically when someone like gets better, right? Like
Hmm?
their health improves. And but it's not actually because of like a real medical treatment. It's because they believe that the treatment is going to work.
Okay, so it's not just in their head, right? Like they're not just imagining they're feeling better, like something is actually happening in their body.
Right, exactly. Exactly. It's not just like positive thinking. I mean, research has actually shown that when people take placebos, their brains can actually release these chemicals like endorphins.
Oh.
And endorphins, those are like natural
Yeah,
painkillers.
yeah, yeah, I've heard of those.
And then there's also dopamine, which is related to like pleasure and motivation. And sometimes placebos can even like affect your hormones and your immune system.
Whoa. It's almost like tricking your body into healing itself, right?
Yeah, kind of. Kind of.
But if the treatment itself isn't actually doing anything, like what is it about the placebo that makes it work?
Well, it seems like there's a bunch of different things going on. The person's expectations play a huge role. If they really believe that the treatment is going to work, it's more likely to have an effect.
Yeah.
And then, like, the way that the treatment is given, if a doctor gives you a pill in a hospital setting, it's going to seem a lot more real than if you just, like, take a sugar pill at home. You know what I mean?
Yeah, that makes sense. That
Yeah.
makes a lot of sense. So like are there certain conditions where the placebo effect is like especially strong?
Yeah, definitely. So, like, with pain, placebos can be really effective. Things like migraines, back pain, even pain after surgery, and then, anxiety. Placebos seem to work best in situations where people are feeling really anxious.
Oh, interesting.
Like if they're about to give a speech or take a test. And get this, for people with Parkinson's disease, some studies suggest that placebos can actually increase dopamine production in the brain, which can help with their movement problems.
Oh, wow. I mean, that's pretty amazing. I mean, it almost sounds like this like hidden superpower we all have, you know?
Yeah,
Just like the power of belief.
absolutely. Absolutely.
So like ethically speaking, if doctors know about this, can they actually use placebos in medicine?
Well, that's kind of a tough question,
Yeah.
because some people think that it's deceptive, like you're tricking the patient, even if you're trying to help them. But then others think that it could be a really useful tool, especially alongside conventional treatments. It's a very tricky situation.
Yeah, that's a tough one for sure. So we've been talking about all the positive effects, but what about the opposite? Like when our beliefs have a negative impact? I think I've heard this called the nocebo effect, right?
Exactly. The nocebo effect is like the evil twin of the placebo effect. If you
Yeah.
expect something bad to happen, it actually might.
Oh, that's interesting.
Like you could be reading about the side effects of a drug, and then you start experiencing those side effects, even though it might just be in your head.
Right.
It's like your body is responding to the negative thoughts.
So basically, like, our minds are powerful enough to make us feel worse too.
Pretty much. Pretty much. Our thoughts and expectations can have a huge impact on how we feel physically.
So I guess what I'm getting from all of this is, like, it's not just about the medicine we take, but it's also like the whole experience of being cared for, right? That plays a huge role too.
Absolutely. Absolutely. The relationship between a doctor and their patient, how clearly they communicate, making the patient feel empowered and involved in their own care, all of that contributes to the healing process.
So, like, knowing all of this, how can we use it to, like, improve patient care?
Yeah.
Is there a way to kind of tap into the power of the placebo effect in, like, an ethical way?
Oh, definitely. Definitely. Even though, like you said, there are some ethical considerations with actually using placebos, there are tons of things we can do to create a more positive and supportive environment
Okay.
where patients feel understood and cared for.
Yeah, yeah.
And that can make a big difference in how well they respond to treatment.
I mean, that just makes a lot of sense.
It all comes back to recognizing that connection between the mind and body,
Yeah.
treating the whole person, not just the disease.
Okay, so Like, just kind of recap. The placebo effect. It's not just some weird thing, right? It's like real proof that our minds have a super strong influence over our bodies.
Yeah.
I mean, it's kind of like we have more control over our health than we might think, right?
Exactly. And you know what? It makes you wonder if our beliefs can have such a powerful impact on our physical health. What other possibilities are out there? What other potential do we have that we haven't even tapped into yet?
Whoa. Yeah, that is a really good question. I mean, there's definitely a lot more to explore there. But I think that's about all the time we have for today.
Yeah,
Thank you so much for joining us on this deep dive. You know, it's clear that the human mind, it's capable of some pretty amazing things.
really is. Really is.
All right, and we'll see you next time.
See you next time.